Danger of depression. Some people think of depression and just think it means someone having a bad day or a short spell of sadness, but clinical depression is more than that. Depression is a serious mental illness that can impact physical and mental health. If not handled properly, clinical depression can lead to more serious issues such as suicidal ideation. Learning about the signs and symptoms that surround depression can help you be on the lookout for it if you or your loved one ever start showing problematic signs. One of the biggest risks when it comes to depression is the increased risk of suicide. According to the Department of Health and Human Services, although the majority of people who have depression do not die by suicide, have depression does increase the suicide risk compared to people without depression. It is estimated that about 60% of people who commit suicide have had a mood disorder such as major depression or bipolar disorder. It should be noted that the risk of death by suicide may be, in part due to the severity of depression. Whether you are dealing with major depression or SAD, getting help is a must. If you or a loved one are dealing with a mental disorder like depression, it is best to reach out to it. Location where you can receive clinical help. Depression can be caused by a number of different sources including genetics, chemistry, environment, and more. Depression can also occur as a result of other serious illnesses like diabetes, cancer, heart disease, and more. When these issues occur, it is important to face these issues head-on and not cope with them in a negative way. Unfortunately, negative coping methods, like drug and alcohol use, can exacerbate the situation and lead to further problems. Luckily, there are resources available to help you learn how to stop drinking and get your substance abuse issues under control. When left untreated, depression can have serious consequences. If left untreated, depression can have serious and sometimes long-term consequences that can affect every aspect of your life. Fortunately, depression is treatable. By getting help and following your treatment plan, you can prevent these complications. Suicide. Having thoughts of death and suicide are symptoms of depression. If depression is left untreated, these thoughts can get worse. Sometimes, you or a friend might feel like suicide is the only way out, the only way to escape the pain. This isn't true. There are many effective ways to reduce depression symptoms and get better. Remember, these terrible feelings and thoughts are not constant and will pass. If you or someone you know is having thoughts of suicide, please get help immediately. You can get confidential support and help for free by reach out to your counseling center or a local emergency room. Addiction. Depression symptoms rarely go away if untreated. In fact, they tend to get worse. Often, to alleviate the symptoms, people turn to self-medicating with substances. The truth is that drugs and alcohol not only worsen symptoms, but they can also increase the chances that you get addicted to these substances. Combining drugs and alcohol with depression is a dangerous mix, which can increase the risk for suicide and further your depression. Self-injury. Another way some people try to cope with depression is by self-injuring, or inflicting pain upon themselves with methods like cutting or burning. While some people don't intend to deliberately harm themselves with these behaviors, serious or life-threatening injuries and accidental deaths can result. Reckless behavior. When people are feeling hopeless, angry, or really bad about themselves, they are less likely to take care of themselves and think about the consequences of their actions. Depressed individuals may put themselves in risky situations, with potentially dangerous consequences, e.g., driving drunk, unprotected sex, poor school performance. Untreated depression can make it very difficult to go to class and complete assignments. That's because depression diminishes one's ability to concentrate, remember things and make decisions. For some people, even getting out of bed requires extra effort. That's why it's important to get help before symptoms get worse and start interfering with school and other aspects of one's life. Relationship problems. Consider how your relationships suffer when you're stressed out. You might lash out at loved ones, stop going to social events, or just want to be left alone. The same thing can happen with untreated depression, except that it's worse, as depression symptoms are more severe. Depression leaves people drained emotionally, mentally, and physically, so it becomes hard to be there for friends and family. Health concerns. Depression can become an unhealthy cycle. People with depression need to take good care of themselves to feel better. But because of the symptoms, they are unable to sleep, or sleep too much, don't want to eat and have no interest in exercise. Because they are unable or unwilling to do these things, the depression worsens and health suffers. When we don't take care of ourselves, it can leave us vulnerable to other illnesses, such as the flu, or worsen health conditions we already have, such as diabetes. Remember, depression is treatable, and so all of these dangerous consequences of untreated depression can be avoided.